Hey guys, today we're going to be talking about something by popular request from last week. Back from the holiday weekend, had it off, so today we're back in full steam. We're going into male testosterone. We're going to talk about low testosterone today, and all about, and what I want to do is actually give you examples of 3 different scenarios, 3 stories that are true, that illustrates my point about why it's important to have a thoughtful approach to low male testosterone issues. If you're watching right now, go ahead and comment where you're watching from. That'd be great. Gives me a demographic. Even if you're watching this not live and later, it's helpful for me to get to know you and know what area of the country or the world that you're watching from. I am Maggie Yu, functional medicine doctor and functional medicine MD. I've been practicing medicine for the past 20 years of my career. And for the first 10 years, I was a family medicine physician. And for the last 10 years, I've been a functional medicine physician. And I graduated from UCLA for med school and undergraduate. And I am doing this 30 days Facebook Live. We're on today, day 8 actually, as a challenge from one of my patients. And many of them actually have asked me that they've benefited from functional medicine approach, and they want to be able to share this with their family and friends in a way that's available to everyone. And it's free and is available on Facebook. So if you love this and you've been getting a lot out of this, please give me a wow face, give me a like, that'd be great, or love. I would love a little love, just to let people know just to let me know and for other people to know that you've benefited from the functional medicine approach and you've been watching some of these Facebook Lives and you feel like that it's given you value. So if you currently have some questions about low male testosterone, you can go ahead and post it right now. So if there's time at the end, I can go ahead and try to address some of those, and if not, in future Facebook Lives. So comments would be great and would be much appreciated. Now, make sure you like the page and you also add notifications. That'd be great. Thank you. Because you'll be notified what my topic is and when I'm on live. And I am doing this. This is day 7, and there's going to be still another 23 days after this on Facebook Live. What we're talking today is about low testosterone in males, and if you know someone you want to share it with, put their name down below so they can watch it in the Facebook Live later or in the rebroadcast. And number 1 is, I'm going to start with a common story scenario that I see. Hi, Deanne. Thank you. Love it. Thank you. Mary. Hi, Mary. Thank you. The top 3 symptoms of low T. That's great. The reason I like that question, I answered it last week actually on a thoughtful approach to low testosterone male and females, is that the top 3 symptoms are commonly missed by physicians and patients as being testosterone related. So top 3 symptoms, number 1, fatigue. If someone is tired, number 2 is weight gain, difficulty with losing weight. Number 3, believe it or not, is mood issues, anxiety, depression, apathy, poor focus. So those are the top 3 symptoms of low testosterone in males and females. And that's why, if you think about it, none of that has to do with sex or even libido. By the time it affects sex and libido, is extremely low. So those are some early or even late symptoms of testosterone that I think that's why it's important to get it tested early. Now, but I'm here the 3 stories I'm going to jump into right away are going to be interesting because they're not typically what you would think. Number 1 is a guy that I saw a year and a half ago, first time, and he was having chronic low back pain. He had been having low back pain for 2 years and was treating with tons of pain meds. It wasn't getting better. He was gaining weight, getting depressed from those symptoms. Really common scenario. And I had a couple questions. I mean, I pride myself as a functional MD of being able to ask different questions, give you different tools, and bring different outcomes. So one of the questions I asked was, hey, have you ever had your testosterone level checked? Have you ever had vitamin D, some of these other testing done? And he said, no. I mean, he's had back pain for 5 years. No one's bothered checking his testosterone, and he was a guy in his early 40s. And I tested the testosterone. Normal should be 500 to 1,000. It was 200. It was about 210. And right away I was like, okay, low testosterone actually prevents healing from injury. So anybody that you know who's a guy who has injured himself, who's not healing or continues to be in chronic pain, and despite doing things to actually address it, testosterone level has to be checked. And this guy's testosterone was 200. No one's ever checked it. And then in further questioning, I went over some of the one of the things I talked about last week in one of my other videos, which is testosterone, a thoughtful approach. Look at that video. was that underlying hidden cause, one of the causes was sleep apnea. So one of the questions I asked him once I got the low testosterone was some of these questions is some of the common reversible causes. And it turned out he was snoring, he was having episodes where he stopped breathing. His wife had noticed it and they just thought it was snoring. But he woke up tired all the time, didn't get enough sleep. He would fall asleep really easily during the day. And it turns out the number one cause of his low testosterone was sleep apnea. I ordered a sleep study from that we do here, that we just send patients home with a kit they can do at home for 3 days. That was great. He did it in his comfort of his own bed. We were able to get an answer, and he was able to get start on his sleep apnea treated, and his testosterone went up. He's currently completely out of pain within 2-3 months of the testosterone of the sleep apnea being addressed. His levels started to come up. He is currently completely off pain meds for the last 12 months. He's currently exercising 3 to 4 times a week at his gym. No pain whatsoever, off all pain meds. And he had been on pain meds for 5 years, and it wasn't even controlling his pain. So this is a really common scenario. So really important to think about this. If you have chronic pain, or you know somebody who has chronic pain, or they injure themselves, even with the elbow injury, and it's just not getting better over time, low testosterone is a big issue here. And so that's a really good story to illustrate that. Story number 2. So if you know somebody who's in chronic pain, or you yourself are, go ahead and say, I know someone. Yes, I've seen this scenario, and I can guarantee you no one's tested a testosterone. If that's true, say yes, that's true. Like, I know somebody like this and they never had their testosterone checked. It's really important, and it's important after they get checked to actually say, hey, well, what are some of these underlying causes that are causing it? And maybe some of these people do need testosterone replacement, and I've seen it where these causes are addressed, they still have low testosterone, I've replaced the testosterone, and boom, within 2 weeks, their pain is gone. So this is not an uncommon scenario at all, and unfortunately, most people don't know that this issue exists in chronic pain. Another story that I'm going to talk about is somebody who it's a guy that I saw for the past 8 years, and he was diagnosed with having fibromyalgia, which is a lot of muscle pains and severe fatigue, having trouble with functioning with his work. And years of this. And with fibromyalgia, doctors really have no, regular doctors really have no cure for this, quote unquote. And he came in to see me, and one of the issues that came up that I identified is that what people don't realize is that food intolerances is a big cause of low testosterone and some of these chronic symptoms like fibromyalgia. It turned out this person had low testosterone. I tried to dig deeper. It turned out that this person also had a family history of some food issues, but never been tested himself. And so one of the areas that we explored was there gluten or any other food intolerance? And I am a huge proponent of testing. I'm not big on, like, I feel you're woo-woo and you have low testosterone, take these supplements and avoid 30 foods on the planet and slowly put it back in. That's called elimination diet, which I'm not a fan of because you can get really faulty data from that. And there's a simple blood test that you can do in our office, which tests for 96 of the most common foods. Boom. Gluten intolerance, we identified it. So once this person removed gluten and some of the other foods that he was intolerant to, with the help of a functional nutritionist in our clinic. Mind you, I'm not just gonna hand you a slip and say, hey, go away from gluten or go away from dairy, and not give you the tools, because it doesn't work. So big on functional medicines providing different tools and better results and outcome. Once this person was off gluten and with the diet, totally off pain meds. Okay, this person was on tramadol for years, which is a mild narcotic medication, and was still in a lot of pain, was poorly functional in his job. Currently, no pain medication whatsoever for the last 9-10 months since we've identified the gluten as an issue and really focused on that. So it's like this is such a common scenario where somebody's dealing with gluten or other food intolerance, doesn't know it, doesn't work with someone who's a functional MD who knows how to do food intolerance testing, and it's this huge underlying issue. So this person is no longer in pain, depression is pretty much almost gone, and this is changeable in a very short period of time. So if you know someone with fibromyalgia, you know someone that, you think has food intolerances, and they have never gotten their food intolerance tested, you could say me too. Because I could tell you right now, lots of people have food intolerances, and it's an underlying cause of some of these major health issues, but yet no one bothers to test it. So food intolerance is a key thing to consider testing. And if you would like food intolerance to be addressed more in food intolerance testing, please write more on food intolerance, and I will definitely be bringing that back full circle. So number 3 is a story about a man with chronic anxiety. Long history of anxiety his whole life, but it's really taken way worse. He's in his early mid-40s, and he's more on food intolerance, and he's really gotten a worsening of the anxiety over the past couple years, and depression or irritability, just acting out with his partner and his kids, right? And interestingly, he's a vegetarian who doesn't eat any vegetables. And that's not uncommon to see. People will say they're vegetarians, they don't eat meat, right? And then, but they carb and load up on carbs. And one of the most important things was when we actually tested his food intolerance, there really wasn't much. But what we found when when my nutritionist worked with him to do a to do a blood sugar assessment, was that because he was eating carbs throughout the day and it was going up and down, he had a huge blood sugar issue. So high blood sugar, low blood sugar, the ups and downs of that, wave of that, actually shuts down testosterone production. So this guy had testosterone around the 300 range, a lot of symptoms associated with it, and it turns out was not food intolerance because we tested it. It turns out it was a big blood sugar issue. And I can tell you right now that Frankie, my nutritionist that works here with us, our functional nutritionist, and I, when we actually take time to do a careful diet history, and I had someone even earlier in the week that said my diet's great. Turns out, well, yes, somebody was avoiding gluten, but not avoiding all the sugar and carbs, right? So we worked with this patient to focus on the blood sugar issue, really working on more of a paleo or ketogenic approach to eating food. And what you're going to see with this person is, we haven't seen him for a follow-up, but I've seen people like this over and over again, is that typically about 6 or 7 weeks into it, they start right away. Oh, actually, we had a gentleman who we worked on this, even today we saw. And the first thing he said was, my afternoon fatigue is gone. My afternoon crash is gone. So this energy crash in the afternoon, big blood sugar issue, and testosterone related as well. And what you find is when you actually spend time to thoughtfully look at someone's diet and you think through, is it food intolerance? Is it blood sugar? Some of these, is it the timing of how you're eating? Is it some self-limiting beliefs about how to eat that you can't get through? Making these breakthroughs in diet is huge in fixing testosterone as a reversible cause. And back to, someone had mentioned what formulations of testosterone comes in. I can do way more on what I can do as far as treatment options for low testosterone. If you would like that, go ahead and put it in the comment section, more on testosterone treatment in males, and I can spend a whole Facebook Live talking about some treatment options with you guys if you would like. Were there any questions? Okay, so some of the, since we have a little bit of time, I'm just going to go into really quick, if the ways that we can replace male testosterone. There are, for people who are borderline, there are supplements and herbs that I can recommend. And really be careful, people. Like, there's so many things being sold out there for raising testosterone. There are supplements that are either not effective, have fraudulent claims, and just don't do what it's what they claim to do, and for prices that you shouldn't be paying for. So supplement evaluation is something someone like me, who's a trained functional MD or a naturopathic physician, would really know what to do as far as the right supplement for your issue. Because just for me alone, I can tell you right now, there's probably about 10 different herbs and supplements that I would recommend for low testosterone. And depending on the cause, it would be a different recommendation. So I think it's really expensive to buy something that doesn't work. So it's really important for me to actually look at what's causing your low testosterone and say, this is the specific herb that you need. And that is actually a cost savings, because you actually get the result you want, tailored, customized to you. So there are herbs and supplements that I recommend. I also will treat testosterone by definitely some testosterone supplementation. So there are also ways to give testosterone, such as injections. There is I compound for patients a lot, so I will compound lozenges to go under the tongue, or skin creams, and there's commercially available skin creams and gels that are available with pros and cons to each. So Mary had mentioned more on testosterone treatment, and I will definitely add another Facebook Live session to go into that. Yeah, sleep apnea. Thank you. So Jonathan is mentioning over there that addressing sleep apnea really changed testosterone levels, and that's such a common scenario. And so there's a lot of patients like this that I've worked with that I never had to even treat with testosterone that we've reversed low testosterone on. So thank you for that feedback. So what I'd love for you guys to do right now is that go ahead and, if you enjoy this talk, give me a wow face, give me a love, give me a thumbs up. Tag anybody that you think could benefit from watching this video later, because the rewatch rate is really high on these. So it's not just during live, but thank you. It's not during live. So go ahead and just comment, give me some loves, give me some thumbs up. That actually moves it up also so that it makes this higher in people's feeds so more people can get to see it. You also like my page and turn on notifications, and that will help with you being notified and anyone else being notified when I'm on live. So this is really, thank you for all the love. This is completely driven by all of you. So if you have more topics you would like to address on Facebook Lives, I'm getting that there's going to be a low testosterone treatment one that you want on. So I'm thinking we'll be able to do that sometime the next, I have 23 more days of Facebook Live, so great. Thank you so much. And remember, also sign on to join my list for the email list, because I have some bonuses that are going to be coming out on email for people with some hacking tools for hormones. Okay? Thank you and have a great day.